Let's be honest, guys. If you're over 50 and you've noticed your erections aren't as strong, or you've had a few drops of urine leak out when you cough, laugh, or even after you finish at the bathroom, you are not alone. This happens because two key systems in your body start to weaken with age. Blood circulation. Your arteries become stiffer, so it's harder to get enough blood flow into the penis for a firm erection. Pelvic floor muscles. These are the hidden muscles that control your erections, ejaculation, and bladder. Over time, they lose strength and flexibility, especially if you sit a lot. The good news, just like any other muscle group, you can wake them up and make them stronger again. And the best part is, you don't need fancy equipment or hours in the gym. 5 simple stretches can improve blood flow, relax tight hips, and activate your pelvic floor, giving you better erections and more bladder control. Think of it this way. If you train your arms, they get stronger. If you stretch and activate your pelvic muscles, your erections get stronger. Simple as that. Most men don't even realize they have a pelvic floor until it stops working the way it should. But this small group of muscles plays a huge role in both erections and bladder control. The pelvic floor is like a hammock made of muscle that stretches from your pubic bone in the front to your tailbone in the back. It supports your bladder, bowel, and prostate. When it's strong and flexible, it works like a valve. It locks in urine until you're ready to go. It helps push out urine and semen when you need to. And it supports blood flow during an erection, helping you stay hard. But here's the problem. Years of sitting, poor posture, surgeries, or simply aging can make these muscles tight or weak. Tightness makes it harder for blood to circulate. Weakness makes it harder to stay in control. The result? Softer erections and those annoying drips of urine. That's why stretches matter. They don't just relax stiff hips and lower back muscles, they directly take pressure off the pelvic floor and train it to work again. Once you wake it up, you'll notice the difference not only in the bedroom, but every time you go to the bathroom. Let's start with the hip opener stretch, because tight hips are one of the biggest hidden causes of weak erections and bladder leaks. Think about it. Most of us spend hours every day sitting, at the desk, in the car, on the couch. This constant sitting shortens the muscles around your hips and pelvis. When these muscles get tight, they pull on your pelvic floor and restrict blood flow in the groin area. That's bad news for both erections and bladder control. How to do it? Sit on the floor with your knees bent and feet flat on the ground. Keep your hands behind you for support or against a wall if needed. Slowly drop one knee inward while turning your torso slightly in the opposite direction. Then move back to center and repeat on the other side. Continue this gentle side-to-side motion for about 40 seconds. What you should feel: a deep stretch in the inner thighs and hip joint, a gentle release in your lower back, no pain, just loosening. This simple stretch does 2 things. It frees up tight hip muscles, taking pressure off the pelvic floor. It opens blood vessels in the pelvic region, which means better circulation for stronger erections. The more you practice, the easier it becomes to move deeper into the stretch. Over time, your hips feel looser, your pelvis feels more mobile, and you'll notice improvements not just in performance, but also when you walk, climb stairs, or even stand up straighter. The second stretch is the cobra stretch. This one targets the lower abdominal muscles, the area just below your belly button, which are often tight in men who sit a lot. When those muscles are stiff, they put constant pressure on your pelvic floor and bladder, making both erections and urine control weaker. Why it matters: a tight lower abdomen can lock the pelvis, restricting blood flow to the groin. Many men unknowingly clench these muscles when stressed, which keeps the pelvic floor tense and overworked. Stretching them allows the pelvic floor to relax and function the way it should. How to do it: lie face down on the floor or on your bed. Place your palms flat under your shoulders. Slowly push your chest up while keeping your pelvis pressed into the ground. Lift your head and look slightly upward. This deepens the stretch. Hold for about 30-40 seconds, breathing deeply the whole time. What you should feel: a deep stretch across your lower abdomen, gentle pressure release in the pelvic area, a sense of opening up through the front of your hips and belly. Pro tips: don't hold your breath. Smooth breathing is key. If the floor feels uncomfortable, do it on your bed. Go only as far as feels comfortable. There should be no pain, only gentle stretching. By relaxing the lower abdominal wall, this stretch improves blood circulation around the pelvis, relieves hidden tension, and supports both erection strength and bladder control. It's especially powerful for men who sit long hours and feel pressure or discomfort in the groin. The third stretch is called stirring the pot. It's a playful name, but the benefits are serious. This move loosens up the inner thighs and groin muscles, areas directly connected to your pelvic floor. If these muscles are tight, they choke circulation and make bladder control harder. Why it matters: the inner thighs, adductors, are like support beams for the pelvis. If they're stiff, your pelvic floor can't relax. Restricted groin muscles block blood from flowing freely into the erectile tissue. By stretching them, you release tension and improve both flexibility and blood circulation. How to do it: lie on your back. Use a pillow under your head if needed. Pull both knees gently up toward your chest. Hold the outside of your knees with your hands. Move your knees in a wide circular motion as if you're stirring a big pot. Go slowly, breathe deeply, and keep the motion smooth. Do this for about 40 seconds. What you should feel: a deep stretch in the groin and inner thighs, gentle release in the lower back, increased mobility in the hip joints. Pro tips: don't force the motion. Let your hips gradually loosen. Exhale on the opening part of the circle to deepen the stretch. If your thighs tremble a little, that's just muscles waking up. This stretch is especially useful for men who feel tightness in the groin or who notice leaks when standing up quickly. It teaches the pelvic floor to move freely, restores circulation, and sets the stage for firmer erections and stronger bladder control. This stretch looks very simple, but it has a powerful effect on the pelvic floor. By bringing your knees toward your chest, you gently compress and then release the pelvic region, almost like giving your bladder and pelvic floor muscles a massage. Why it matters: it helps release tension in the lower back, which often pulls on the pelvis. It encourages the pelvic floor to switch on and start working properly again. It improves control of urination and helps erections last longer by supporting blood flow. How to do it: lie flat on your back with a pillow under your head if needed. Bring both knees up toward your chest. Wrap your arms around the top of your knees or shins. Pull them gently closer to your chest, only as far as feels comfortable. Hold the stretch for about 30-40 seconds, breathing slowly and deeply. What you should feel: a pleasant stretch in your lower back and hips, a light compression in the lower belly and pelvic floor, gentle relief, not pain. Pro tips: don't yank your knees in. Let your hips relax into the movement. Focus on breathing into your lower belly. This helps activate the pelvic floor naturally. If it feels too intense, do it one leg at a time instead of both. This exercise is perfect before bed or right after waking up. It helps relax the bladder area, improves pelvic control, and boosts circulation. Many men notice less leaking and more stability in erections after practicing it regularly. The happy baby pose may look a little funny, but it's one of the most effective stretches for men's pelvic health. It deeply opens the hips and groin while directly releasing tension in the pelvic floor, the very muscles responsible for bladder control and erections. Why it matters: tight pelvic floor muscles are a hidden cause of weak erections and leaks. This stretch allows those muscles to fully relax and lengthen. By opening the hips and pelvis, it improves blood flow to the erectile tissue and gives you more control over urination. How to do it: lie on your back with your knees bent. Lift your feet so that the soles face the ceiling. Reach your hands through your legs and grab the outside edges of your feet, or your ankles if that's easier. Gently pull your knees outward toward the floor, keeping your lower back flat. Hold for 30-40 seconds while breathing slowly. What you should feel: a deep stretch in the inner thighs and groin, gentle release in the pelvic floor and lower belly, a sense of opening and relaxation, not pain. Pro tips: If this feels too hard, you can hold the backs of your thighs instead of your feet. Focus on breathing into your belly and letting your hips relax further on each exhale. Over time, the stretch becomes easier and allows deeper release. This is often the most challenging stretch, but also the most rewarding. Men who add Happy Baby into their routine often notice not only firmer erections, but also fewer leaks when coughing, sneezing, or moving suddenly. By now, you've seen the 5 stretches, but let's connect the dots. Why do they actually work for erections and bladder control? 1. Better blood flow. Each stretch opens the hips and loosens tight muscles around the pelvis. This allows arteries in the groin to widen so more blood can flow into the erectile tissue. Stronger blood flow, earn stronger, longer-lasting erections. 2. Pelvic floor activation. The pelvic floor muscles are like the hidden switch for both erections and urination. When these muscles are weak or tight, you may have leaks or difficulty staying hard. Stretching releases unnecessary tension, then re-engages the muscles so they can do their job again. 3. Reduced pressure on the bladder. Tight hips and lower abdominal muscles push down on the bladder, causing small leaks. These stretches take that pressure away, giving you better control and fewer accidents. 4. Hormonal and nervous system support. Relaxed muscles mean lower stress levels. When stress hormones, like cortisol, drop, testosterone works better, and so does your sexual function. In short, these stretches don't just feel nice. They are a direct way to improve circulation, strengthen pelvic control, and restore confidence in both the bedroom and daily life. Before you turn these stretches into a daily routine, it's important to know a few simple tricks that make them safer and more effective. 1. Breathe, don't hold. Many men instinctively hold their breath during a stretch. That creates tension and reduces blood flow, the opposite of what we want. Instead, breathe slowly. Inhale through the nose, exhale through the mouth. Every exhale should feel like you're releasing tension from your hips and pelvic floor. 2. No pain, only stretch. A deep stretch is good. Sharp pain is not. If you feel pain, you're forcing it. Go back a little, stay comfortable, and let flexibility build over time. Remember, these are recovery stretches, not powerlifting. 3. Posture matters. When lying down, keep your back as flat as possible. When sitting, sit tall. A slouched posture puts pressure back onto your pelvic floor, which cancels out the benefit. 4. Bed or floor, both work. If getting on the floor is uncomfortable, all 5 stretches can be done on your bed. The key is consistency, not the surface you use. 5. Consistency beats intensity. It's better to do these stretches gently every day for a few minutes than to push hard once a week. Your body responds to regular, low-intensity practice. These tips may sound simple, but they make the difference between just doing a stretch and actually rewiring your pelvic floor for stronger erections and better bladder control. Now that you know all 5 stretches, the final step is turning them into a simple daily routine. The good news? It only takes about 10 minutes a day, and you can do it in the morning, before bed, or both. Here's the sequence. Hip opener, 40 seconds per side, gently rocking your knees inward and outward. Cobra stretch, 40 seconds, pressing up with your hands and breathing deeply. Stirring the pot, 40 seconds of circular knee movements, slow and controlled. Knee to chest, 30-40 seconds, hugging both knees in and breathing into your belly. Happy baby, 30-40 seconds, pulling your knees outward and letting your pelvic floor relax. Total time, around 5 minutes if you do 1 round, or 10 minutes if you repeat twice. Best practices, do it daily, just like brushing your teeth. Don't rush. Focus on breathing and letting the muscles open up. Combine with light walking or activity during the day for even better results. Expected benefits: firmer, longer-lasting erections thanks to improved blood flow, stronger bladder control, reducing leaks and urgency, less stiffness in your hips and back, making you feel younger and more flexible, more confidence, because when your body works better, so does your mind. This is not a miracle trick. It's a science-backed habit. If you give your pelvic floor the same care as your arms, legs, or chest, you'll notice real changes. The key is consistency.